Thank you, Mr. President and colleagues. I stand and urge your support of SB 305 and want to commend my colleague from San Diego in bringing this forward. This legislation will help terminally ill patients by giving them access to medical cannabis in healthcare facilities. The father of the boy that this bill is known for, Ryan's Law, testified before our committee, and he spoke from the heart. His son Ryan was dying of cancer and enormous pain, and sadly at such a very young age. But as we see often when people get end-stage care through hospices or in the hospital, the doctors often throw narcotics at them. They throw fentanyl at them, morphine at them, Dilaudid, and the problem is that you are mitigating their pain, but in the last few days or last few hours of their life on this planet, you're rendering them to be unconscious. And many of these terminally ill patients, including Ryan, wanted to be alert and awake and spend every precious moment that he had left on this planet with his loved ones. But the only way that he could do that, because he discovered that cannabis could take his pain away and would not make him unconscious, was to continue the utilization. But that's something that he legally couldn't do here in the state of California because of our current laws. You know, we've been talking about medical marijuana now for over a decade, and we've learned throughout this decade that there are many efficacies, many wonderful uses for medical cannabis that we didn't really know about because, frankly, because it was a Schedule I drug, we didn't allow institutions such as Stanford, UCLA that we recognize today, UC Davis, to study the medical efficacy of cannabis, but other countries have and have shown it to be a very good drug. As a pharmacist, I can tell you that cannabis has a potential of helping people manage their pain and without many of the negative side effects of opioids. I hope that we can all agree that a dying patient should never live his or her last days in needless pain or agony. The FDA already approved certain cannabis derivatives like CBD and Arenol because of their proven medicinal value. And while the FDA has admitted certain value to cannabis derivatives, its insistence on calling this a Class I drug has meant a severe lack of clinical studies on the benefits of dying patients who needlessly suffer and shouldn't have to. And while the FDA has continued its practice of treating marijuana the same as heroin, 33 states now embrace medical cannabis as we have led the way. Not because studies done here in the US, but because of studies conducted in countries like Israel that prove that marijuana and its congeners truly have medicinal value. We certainly know again that Marinol has been used for AIDS to stop the wasting syndrome in chemotherapy patients so they can keep food down after they get some of these toxic drugs that are so poisonous to their body. If cannabis is the medication that allows a person to better cope with pain and suffering in their final hours, then we should stand behind them and alleviate some of that suffering. No one should be forced to endure pain. SB 305 will give dying patients a good quality of life in their numbered days and, for many, hope. What happened to Ryan Bartell should never happen to anyone. Again, in the state of California, people deserve to be pain-free in their dying days, and they deserve to have consciousness to share their finite time with their loved ones, and this bill accomplishes that goal. With that, I want to thank the Senator, my friend from San Diego, for championing this issue, and I'll be voting for SB 305 and encourage all my colleagues to do the same.